Hi, welcome. This is a practice for lower back pain. And this is more of a yoga therapy approach to yoga, so we're not going to really be doing anything strenuous, and we aren't really going to be stretching too much. This is more about softening some of the things that can tend to contribute to low back pain. As many of you know, I'm on my way to being a yoga therapist, and this is the sort of approach that you want to take to kind of ease into things. I think a lot of times when we have pain in our body, and I'm speaking for myself, my first reaction is stretch it out. And then I hopped on the myofascial release train, which I am a huge fan of, but then I started smashing everything. And sometimes you need to take a little bit more of a gentle approach and let the things that are causing flare-ups in the low back some time to soften and release before you stretch and strengthen and smash. So these are some of my go-to poses. I have some mild scoliosis, and I have struggled with SI joint issues and some stuff going on in my low back, and every now and then I'll get a flare-up, especially when I'm sitting a lot, when I'm stressed. A lot of emotion can be held in the low back, and these are some pretty emotional times. There's a lot of uncertainty and a lot of lumbar issues. Even if you have something going on there already, the emotions can just exacerbate it. So I want to encourage you, as you do this, see if you can find a quiet place to be and give yourself some space and permission to set aside this time to practice on letting go of just some of the weight you've been carrying for a moment. The other thing I want to address with this is the causes of low back pain are varied. There are some things that help depending on certain conditions, like if you have a herniated disc, typically extension of the lumbar spine, so slight back bending is recommended for that because of where discs usually herniate. But if you have other conditions such as osteoarthritis in your lumbar spine, back extensions may exacerbate that irritation and pain. So I want to encourage you, as you approach this practice, first of all, listen to your body, and we want to soften and release. And then also, if you're under the treatment, if you're under a doctor's treatment for any kind of condition and they have told you to not do things that I'm going to tell you to do today, listen to them, because you really want to make sure that you've got the right support in your back for what is going on for you. So to start off with, we're going to come into constructive rest, which is one of the best things you can do for lumbar low back pain, and it's pretty easy to do. You don't need a lot of fancy props. I like to call it Stonehenge in my restorative classes because we typically do it this way. So what I want you to do is, if you do not have a bolster, you don't need one for this practice, but if you do have a bolster and a couple of blocks, they're really handy. You will need a block for the next thing we do. So if you don't have a block, you can substitute a couple of books wrapped up in a towel. You could substitute a large softball, can work for that as well. Or you can just really firmly fold some towels to support you, and we'll get to that later. But if you have a chair, or if you're sitting by your sofa, you're going to bring the chair or your mat right to the edge of your sofa. If you've got bolsters and blocks, we're going to do this little number. Take your blocks, place them on the tallest height, and you want them pretty close together. So I would say place them hip width apart, right about where your feet would be standing in relation to one another if you were standing hip width apart. And then place your bolster on top. Stonehenge. So if you have longer legs, you may need more height than this, and that's why I recommend a chair, but I find this is usually pretty good for me. So we're gonna come onto our backs. So kick your legs up onto the back of the chair or the seat of the chair, and then come down, and you want to have your legs fully supported. So get the backs of your knees and the meaty part of your calves right on the chair seat or on your bolster. And now, all you have to do for the next few minutes, and I'm going to be timing us today, so you don't even have to think about how long to hold this. All I want you to do is let yourself settle. So you can either soften your gaze or close your eyes. Begin to notice the movement of your breath in your body. Bring your awareness to the top of your head and notice if you're holding a little tension in your face, your jaw, and maybe turn your head from side to side a couple of times to see if you can let some of the tension up in your head relax. And if you're uncomfortable with your head on the floor or your mat, you can put a blanket or a towel under your head, but I would recommend not propping your head up on a pillow because that's going to give you a little too much flexion of the neck. So you can support your neck with a rolled up blanket or put something behind your head, but try not to push your head forward. And start to let your arms move a little bit away from your body. They're really close to your ribs. Just travel them out to the side a little bit and allow your shoulders to move away from your ears. So I'm actually kind of walking my arms closer to my hips. And palms up is going to be more of a receptive position. It'll help your shoulders go more into an opening position. But if that feels a little ungrounded, if you feel a little anxious or rushed, sometimes turning the palms down can provide a sense of stability and groundedness. So I invite you to take whichever one of those speaks to you in this moment. Notice the quality of your breath. Is it fast or is it slow? Is it steady or erratic? Notice where you feel the movement of the breath the most. Perhaps notice the temperature of your breath. Does it feel warm? Does it feel cool? And as you continue to allow your breath to move in your body, bring a little more heaviness to your limbs, so your arms and your legs. And feel the connection of your hips on the mat. And perhaps visualize your hips being a little heavier. Feel a little more connection with the floor beneath you, the ground beneath you. And draw your awareness to your lower abdomen. and specifically the space between your hip points. So just below your navel and to either side, those bony prominences of your pelvis. Notice all the space between your hip points and visualize your hip points moving a little further away from each other. And observe if that helps you feel a little more softening in this area. Continue to let your breath move, let your shoulders relax, and keeping this soft quality of your lower abdomen. Visualize your hips getting a little bit heavier, your legs growing a little more weighty. And take 3 more breaths here. Deep, smooth inhales and exhales. Allowing your exhale to release completely. Taking a full breath in. And again, exhaling completely. And if your eyes are closed, I invite you to begin to open your eyes. Give yourself a moment if you're in a bright room. Just adjust to the light. And we'll start to make our way out of this position. So you can reach your arms overhead and take a little bit of a stretch, maybe bring a little bit of movement to your feet. Then bring your knees in, not all the way. We want to keep everything kind of soft and roll either to your right or your left. And use your hands to help yourself up. So make sure that you're not adding tension where we just took some out. All right, so take your chair away from your mat or come away from your sofa a little bit. Move your blocks to the side. And we're going to take a block. Now I have one of these curved blocks just because I have them and they're awesome. You can do this with a flat block. They're also really good for this, and some people like them more. These may be a little too thick for you, so if they are, again, maybe just use one book, wrap it in a towel. It really doesn't matter what you use, you just want to get a little support. So what we're going to do is we're going to take this edge of the block, so this lowest height, and I'm going to bring it behind my back just to the left of my spine. So there's a little strip of muscles running along your spine, and you want the edge of the block to be lying along that. So I'll show you what that looks like. You're going to come back onto your back, and you'll roll to the right and then scoot the block under you. So I've got this edge of the block just below my shoulders, and body proportion is going to make a difference for this. So if you tend to be a little shorter from here to here, you may want less height, but I'm just going to wedge that just under my back, not along the spine, just alongside it. Then keeping my left knee bent, roll onto the block. So this hip and glute are fully on the floor. This glute is on the floor, but it's not as weighty as my right glute. So it's fine. You just don't want this to be off the floor. So if you have it too far under your low back, it's going to look like that and it won't feel very good. If you have it too far up, you won't be able to get your shoulder down. So it's very much the Goldilocks effect here. You want to get it just in the right spot. And for those of you who know a little anatomy, this edge, the top edge of the block, you're kind of lining it up around where T12 is on your back, just to the side of it. And then once you've got that, this knee is going to stay bent. That is your left leg. Your right leg is going to stay straight. And you can stay here with the knee bent, arms beside you, or raise your left arm overhead. And this is just going to increase a little bit of the lengthening. So what we're doing here is we are releasing the psoas muscle. So if you're familiar with the iliopsoas muscle, it's a very large muscle in the body, very strong muscle, whether you strengthen it or not. You really don't need to strengthen the psoas muscle because it works so much anyway. But it is really hard to stretch because it is so strong, and it attaches on the back of your body along the spine starting around T12, and then it winds through your abdomen and comes out on the front of your body and wraps over your hips and connects all down through here. So there's a lot going on with this muscle, and the thing about it is if it gets tight or if it's got any spasms going on in it, it can pull from the top down, from the bottom up, and it tends to put a lot of compression in the lumbar spine. So this is a way to soften and release it without irritating it more. So we're going to be here just a little bit longer. We're almost done. And if you're not feeling anything, you may not. That's fine. If you want to try to deepen this a little bit, just start to rotate your body more towards the block. Not in a massive amount, but just kind of energetically, almost like you're starting to roll onto your left side. And you'll notice that your left knee probably will start drifting to the left. So pull your knee back towards the midline and try to relax here for a few more breaths. We're almost there. All right, slowly roll to your right side, just enough to move that block out from under you, and straighten your left leg out along the mat too. And I want you to take a moment here to notice your body. Let your arms rest beside you. And just notice if you feel any difference from one side to the other. So if I were to describe what's going on in my body, I always feel like the side that I just did feels wider and heavier towards the floor, even up into my shoulder, honestly. And an interesting thing, not everybody will see this, but if you look at your feet, some people, you'll see your left foot turns out a lot more than your right. Some people don't, but that can be just a sign that you got into that muscle that tends to be very tight. All right, so we need to match it up. If you stood up and walked around at this point, you more than likely would notice a little bit of a difference. So we're gonna roll over to the left, and again, low height of the block, this width. So if you do it this way, it's gonna be way too long. Roll over to the left and just work the edge of that block underneath your back, just to the right of the spine. So the edge of the block is running along that strip of muscles. And you want your right glute to be touching the mat. It does not need to be a deep support right there, but you do want it touching. You want your right shoulder on the mat. And then right knee stays bent. Option to bring your right arm overhead. If that's too much on your shoulder, didn't mention this on the other side, but if you've got something going on with your shoulder, you can take your arm out like a T, or you can just keep your hands in. Like, this is not necessary, but it adds to the softening and the opening. So So just like you did in constructive rest, see if you can allow your breath to move freely. See what you can soften. The challenges of doing work like this is, honestly, to be still. Sometimes movement can make things easier, sensation can make things easier. So when you're doing these passive releases and there's not really, can't tell anything's going on, sometimes that's the hardest part, is the mental aspect. Now I will say, if you've got anything going on with this muscle, some of you may be feeling a dull ache just to the inside of your right hip point. When I'm having a spasm or a flare of this muscle, if it's been kind of hurting, like that can be something that I feel. I would say if you're feeling like a lot of pain, then maybe leave this one out. It shouldn't hurt. It just feels like kind of an awkward position. So anything above a dull ache, I would say maybe just go back to your constructive rest. We're almost there. Keep smoothing out your breath. Relax your jaw. Okay, roll a little to your left, just enough so you can come off the block and remove it and place it to the side. Stretch your legs out, relax your arms, notice your body. Notice if they feel like they match up a little bit more. And you can do this particular release every day. So we're gonna roll to one side and come up. It's the nice part about it with myofascial work. You really don't want to work on muscles every day. It can cause a lot of irritation, but this is a release. This is a really soft, non-invasive release. So this kind of work you can do every day as long as it's not painful, like I mentioned before. All right, so we're gonna do this next one on our abdomen, and if you want a little more padding from the floor, place a blanket on your mat under your hips. So you're gonna come onto your abdomen, and there are stages to these next three poses we're gonna do. The first one, I would say, if as we progress, they don't feel comfortable in your body, stick with the first one or just stop here. This is a good place. This will be a good place to stop after this. But we're gonna come into Sphinx pose, and the way I would recommend placing your arms for Sphinx pose is to clasp your elbows in front of you and hold on to your elbows with more the middle of your palms, and that's typically going to show you about shoulder width apart. And then the closest you want your shoulders to you is right underneath, your elbows to you, is right under your shoulders. If you bring them too far back, it tends to do the opposite of what we're trying to do. So you either want to have them more underneath your shoulders, or you can even bring them a little in front of you. Really just depends on what's serving your body better. And if this is too much for the ankles, you can curl your toes under. You could roll up a blanket and put it under your ankles. So once you've got the placement of your elbows, then bring your forearms parallel to each other and let your chest relax towards the floor. So I'm going to keep my gaze down so that I don't put a crick in the back of my neck. I see this a lot. And if you notice the sound of my voice changes, that's really not what we're looking for. I want to keep the back of the neck nice and long, and then pull your shoulders towards each other. So plug your shoulder blades towards each other. A little bit of activity there. So this isn't, if your shoulders are coming forward, just think about as if you would put a ping pong ball between your shoulder blades and you're trying to just lightly hold onto it, keep it from rolling away. And you can add a little activity into this by pressing your forearms down and attempting to drag your elbows more towards your hips, but we really want to make this more passive, so if that adds too much tension anywhere, see if you can relax and just think about that ping pong ball between your shoulder blades. Keep the back of your neck long. Now press your tailbone down. So it's almost like you're trying to sandwich your tailbone and the front of your pelvis together. So your pubic bone and your tailbone. And lift your chest a little, almost like you're moving it forward, and let your abdomen sag towards the floor. Relax here. And this is known as Sphinx pose. This is a yen posture. And we usually hold these for 3 to 5 minutes. So you can increase time in this, and this is a suggested posture for lumbar disc issues often, but we're not gonna hold it for 5 minutes today because we're doing some other things. But if you're feeling like, oh yeah, this is really taking some pressure off my back, then just know like you can stay in this longer if it's giving you some relief. I would say keep it under 5 minutes at first, but you don't have to come out of it straight away. We're going to come out of this pose now. So walk your elbows out to the side and make a little pillow with your hands and let your forehead rest. And then bend one knee and then the other. Just bringing a little movement into this. This is lightly going to rock your pelvis from side to side. Really, really gentle movement. All right, so you can do that again, or we're going to add to that and take this into a little bit of dynamic movement. So bring your feet hip width apart. So if your feet are together, walk your feet until you feel a little bit of pressure release from your low back. And if you're like, I don't really know, just kind of walk your feet in and out and find the spot that feels pretty comfortable. Then with your forehead on the mat, bring your hands towards your chest, so you're trying to line them not really under your shoulders, but maybe a little back from where your shoulders are. And let your feet, the tops of your feet, so where the shoelaces would be, let that press into the floor gently and pull your shoulder blades towards each other. As you inhale, just lift your chest up. And as you exhale, lower down, turn your gaze to the left. Inhale, lift your chest up. Turn your gaze to the right, lower down. So you're really not using your hands, they're just there to steady you. Inhale, lift your chest up. Exhale, lower down, turn your head to the other side. Inhale, lift up. Exhale, lower down, turn your head back to the right, left cheek rests on the floor. Inhale, back to center. Stay with that height, or if your back permits, as you inhale, press into your hands, lift up a little bit more. And as you exhale, lower back down, turn your head to the left. Inhale, lift up, press into your hands, keep squeezing your shoulder blades together, and exhale, lower, turn your head to the other side. Again, inhale back up, and you don't have to lift this high. Exhale, lower down, turn your head to the left. That little movement may be enough, just showing you the progression that you can come into. Last time, inhale to come back up. Exhale, turn. The last set to the left. This will be the last one. Come up and down. And then make your way back with your forehead on your hands. So this last one we're going to do, you can do either of those previous or to add to the low back. And I find this is really helpful for the SI joint if it gets out a little bit. So this particular pose, you can do it in your baby cobra here with your hands on the floor. And I'm going to show you more from Sphinx just so you can see this is an option, but what I want you to do is look at my legs for a moment. So this is relaxed. I've got my feet, and I am going to bring my feet together for this one. So this is relaxed, and you can see my knees are on the floor, or maybe you can't. But when my legs are relaxed, my knees are on the floor. When I press the tops of my feet down, the shoelace part of my feet, my knees are lifted, my legs are straight. So you don't have to do that like with everything that's in you, but you just want to get your knees to start lifting off the floor. Because when we lift, if the legs are relaxed, we're not going to be lifting as much from the upper part, the glutes. We're going to be starting to fire up the hamstring, and that's going to kind of help us. So the more you can keep your legs straight, you really don't have to lift your legs that high at all. I'm going to exaggerate it so you can see what's going on, but if you just lift your feet to a hover, that's enough. So what you'll do is you'll bring your forehead to the mat. You can make your little pillow with your hands. Press the tops of the feet down until the knees are lifted. As you inhale, pull your sit bones towards each other, so kind of engaging your glutes. You don't want to clinch. And as you inhale, lift your legs, straight legs up. As you exhale, take your feet wide apart. As you inhale, keep your legs straight, bring your feet back together. As you exhale, lower your feet back down. Again, inhale, straight legs lift. Exhale, feet wide apart. Inhale, feet back together. Exhale, feet back down. Okay. So again, big movements aren't important. You just follow your breath. You can just lift your feet to a hover, take your feet a little apart, bring them back together. It's really about engaging the muscle groups. It's not about big movements. So try that again. Bring your forehead down, straighten your legs. Inhale, lift your straight legs. Exhale, take the feet apart. Inhale, bring the feet back together. Exhale, lower back down. Inhale, lift the legs up. Exhale, take the feet apart. Inhale, straight legs, bring the feet back together. Exhale, lower back down. One more time. Inhale, lift the legs up. Exhale, feet apart. Inhale, feet back together. Exhale, lower down. Then bend your knees. Windshield wiper your knees, your feet back and forth. Make your way on to hands and knees. And if you would like to end this practice in your constructive rest with the backs of your legs on the chair or building your Stonehenge, that would be a really nice way to finish this. But this can be a really short practice, and you can do this just one of these poses if you're feeling a little bit of discomfort in your low back. These are great therapeutic uses of our yoga poses to help us out. So I thank you for joining me, and I hope that you're having a wonderful day. Thank you.